Hi, Peter. My name is Emilia Ripoll. I'm glad you're here today. And Deborah?
Deborah.
Nice to meet you. So when PSA first came out, the numbers that were quoted initially were 0 to 4 is normal, 4 to 10 is intermediate, and greater than 10 is cancer. And that was great for a long time. That's all we had, and it was good. And what we realized that that applied to maybe 80% of the people, but it definitely didn't apply to everybody. And that was not sufficient. So we needed to start looking at other ways to interpret that information, okay? The thing about prostate-specific antigen is that it's specific to the prostate, but it's not specific to cancer. So for example, if you ride a bike, if you ejaculate, if you put pressure on the prostate, all of those things can make your PSA go up, okay? But that doesn't necessarily mean that you have cancer. On the other hand, prostate-specific means, let's say you would have another affliction anywhere else in the body. That would not affect your PSA. A lot of people say, well, I've had a cough for 3 weeks. Will that affect my PSA? Absolutely not, because it's not affecting the prostate directly, okay? So when we start looking at what else could we look at that will help distinguish the people that could end up having cancer versus the ones that not, we started looking at some concepts. And one of the first concepts that came out was PSA density. And PSA density is a fancy way to say that as the prostate gets bigger, the PSA gets larger. Why? Because we know that both cancer cells and normal prostate cells are going to make PSA, okay? The difference is how much it gets released into the bloodstream. All right, so density, in one way to plot these would be if you look at PSA and you look at the size of the prostate, that there's no doubt that you're going to get a linear, and it's pretty linear, meaning, you know, once again, the bigger the prostate, the higher the PSA. So how is that helpful? That could be helpful in that, for example, if you do a rectal exam and, you know, you look, of course, for bumps and lumps or anything that is out of the ordinary. But if somebody has a very generous prostate and their PSA is 4, but you feel the prostate and is the size of, you know, a grapefruit, well, no wonder they're going to have a PSA of 4. So that would be congruent, that would be consistent. On the other hand, if you do a rectal exam and the PSA, you know, is 4, but the rectal exam, the prostate is very little, that might raise some suspicion that there could be something going on, okay? The most accurate way to do a PSA density, of course, is either if you had an ultrasound or some kind of imaging. So doing it crudely with the rectal exam is not perfect, but once again, every little information that we can gather and add to this, the better off we are. Why? Because we don't want to make a major decision like doing a biopsy to somebody with just one piece of information.